All right. It is now 6:30. Call the August 24th, 2015 Budget Committee meeting to order. We'll start with Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we have a couple absences tonight. Craig is out of town, and Meg and Gail emailed me right before the meeting saying they were having a conflict, so they're all excused. I will follow up with Larry to see what's up there. So before we get started, just wanted to let you guys all know, Greg White, CEO of Lamprey Healthcare, is here. We'll get to him in just a second. We'll go through the budget meeting, or the budget minutes from the June 15th meeting, and then I got a few things to go through to kind of get us set for the next 4 months. And I have some information that we'll kind of go through just to kind of prime the engines for budget season. So first and foremost, do I have a motion to accept the minute meetings?
Motion to accept the.
Actually,
no, I wasn't here.
You weren't here. We don't have our secretary either.
No, we do not.
I'm gonna be. Guess you want to take some notes?
Some notes.
So I'm like, we don't have our secretary. It is the 24th, right? Okay, just making sure.
I'll make a motion to accept the minutes for
Okay, Blue.
June 15th.
Do I have a second?
Second.
Any edits or any revisions to the minutes? Okay, I didn't have any either. It looked actually pretty good.
Yeah, very good.
Yeah, she's really detailed. All right, for all those to accept the minutes as written, aye.
Aye.
And one abstention.
2 abstentions.
2 abstentions. All right, you weren't here either.
Yep.
Okay, so with that done, let's move on. Greg actually had reached out to me probably June-ish sometime and asked if he could come and spend some time with us and just educate us a little bit more on the Lamprey Health Center, especially I think last year after the vote in January. It was clear that we didn't really have as much information as we needed to, so I thought this was a great avenue as we get into budget season, just for him to kind of educate us and the community a little bit more on really what the Lamprey Health Center is, and what they do for the community and everything. So as we get into budget season, we'll have a little bit more information. So Greg, if you'd like to step up to the podium. And
thank you very much.
You're welcome.
I have some packets about Lamprey with me.
Bring it on. Yep, I'll pass them out. Thank you, Greg.
Thank you.
So that's general information about Lamprey Healthcare. I'll just kind of paraphrase a lot of that in my remarks, and then hopefully I can answer your questions. I'm Greg White, CEO of Lamprey Healthcare. I've been here for about 2 years. My predecessor, Ann Peters, was in this role for about 34 years, so I've got some catching up to do. But part of my reason wanting to visit with you all is with Ann's retirement. I think a lot of history and connection with the town may have retired with her, so I wanted to make sure I had a chance to introduce myself to you. I'm not from town, but I'm born and raised in Milford, New Hampshire, so I understand the budget process and participate in it in my hometown. So, Lamprey Healthcare, as you know, is a 501c3 not-for-profit corporation. We are freestanding and independent. It is our mission to provide high-quality primary medical care and health-related services without regard to a patient's ability to pay. With that mission, we've been able to achieve the designation of federally qualified health center, or you may have heard it referred to as a community health center. With that comes a fair amount of federal funding to help us keep the doors open and to offset the free and discounted care that we provide, as well as a little different set of reimbursement from Medicaid and Medicare. As a federally qualified health center, the majority of our board of directors must be consumers of services at our health center. We actually have 4 Newmarket residents on our board of directors, one of which is here with me this evening, Betty Crapo. She's a past board chair. We employ roughly 150 staff over our 3 sites in Nashua, Newmarket, and Raymond. All of our providers, the physicians, the nurse practitioners, the physician assistants, are our employees. They are not contracted. We are very fortunate to have admitting privileges with Exeter Hospital, and they have been a great partner with us over the years. We are separate and distinct from them. We are not part of Exeter Hospital. They do co-locate services in our facilities in Newmarket and Raymond, primarily X-ray, physical therapy, occupational therapy. I think we even have a podiatrist coming in Raymond. And you may actually see their mobile mammography unit coming through our facilities once a week as well. So we are the benefactors of some generosity from Exeter Hospital in terms of a community benefit grant each year. With the economy downturn over the last few years, that has come down, but it's still in place, so they still work with us quite closely. Just some more things about us. In the past year, we've actually implemented a new integrated behavioral health program where we have a counselor embedded in the primary care team so that folks can deal with their stress or their depression or dealing with a chronic illness, more so the worried well, as it were. We're working with Seacoast Mental Health right now to have a psychiatric nurse practitioner placed in each of our sites as well, so that's under development. We also house the Southern New Hampshire Area Health Education Center, which is a workforce development program focused on nursing, medical interpretation, and community health workers. We also coordinate practical rotations for medical students, nursing students, and residents. In July, we became the fiscal agent for the Seacoast Public Health Network, which is a collaborative of agencies such as our own, hospitals, municipalities, police departments, school districts, you name it, that come together to help prioritize for public health matters. So 2 of the main foci of this entity are emergency public health preparedness and substance misuse prevention. So we're just getting that off the ground. It's housed in our Raymond site. You may see on our sign something called Community Health Access Network, which is a collaborative of 6 New Hampshire health centers that have come together to share an electronic medical record system as well as some quality reporting endeavors. So much more economical to do it that way than replicate 6 sets of infrastructure. And we have a transportation program, which I'll talk about in a minute. So more specifically to Newmarket, our Newmarket serves this town and the contiguous towns around us. We provide primary care to 5,200 unique patients each year for roughly 23,000 visits. We deliver and care for 100 babies at our Newmarket facility, another 100 in Raymond. So we serve over 430 homeless individuals and employ 65 employees in Newmarket, 14 of whom are Newmarket residents. Of those 5,200 patients, 1,550 are Newmarket residents. They account for 6,000 visits. 20% of those folks are on Medicaid. Another 15% have no insurance at all. So in fiscal year 2014, which was as of last September, we provided $58,000 of free and discounted care to Newmarket residents in particular. As an organization, we provided over $1.4 million of free and discounted care. We had to write off another $495,000 worth of bad debt as non-collectibles, which is really part of doing business in healthcare. So, we leveraged $72,000 worth of free and discounted prescriptions through our medication assistance program. And a number of our other programs, our larger one is our school-based dental program, which sends a dental hygienist out to 10 of the local schools, Newmarket included, where we do screenings, we do education, and some very limited treatment. So identifying kiddos that may have dental issues and getting them hooked up with a local dentist so that those things can be dealt with, because dental health will affect your physical health in the long run. We offer baby basics classes. We have a walk with a doc program you might see out here once a month on Monday nights. Large group of folks walking up the sidewalk, getting some exercise. Kind of a neat program. Our youngest walker was probably a rider. She was 3 months old last week. Oldest, I think, was 82. So We also participate with Operation Santa each year, helping to fundraise and sponsor 65 Newmarket families. And you may be familiar with our road race, which happened a couple weeks ago. We used the proceeds of that race to help support our Reach Out and Read program and our Baby Steps program, which are our pediatric-focused programs. So our transportation program is roughly a $185,000 budget. Over the years, it has largely paid for itself, but with changes in the environment and funding over the last few years, we've seen that come down, and it has run a deficit for the past 3 to 4 years. Fairly sizable. Part of that results from a reduction in state funding. It results from the elimination of the coast funding. At one point, we were contracted to do one of the coast routes out to the seacoast. So we've had to pare it back. We have 3 drivers, including one of which is a part-time manager. Previously, we had 4. We operate 3 vans, a wheelchair van, and a little station wagon. So there are 2 aspects of the program. There's the senior program, which arranges as a group with the buses for folks to get out of their homes and get to the store, get to the bank, get to the doctor, get to the pharmacy, keeps them in the community as opposed to not being able to support themselves in terms of their day-to-day activities. We also have a demand ride type call up. I need a ride to the doctor. We come get you. We bring you there. So these services are provided like our other services without regard to an individual's ability to pay. We do ask a small donation, but we are never refusing a ride if somebody is unable to pay that. So overall, the towns that we are fortunate to receive contributions from constitute about 41% of our budget. The state picks up another 24%. The balance comes from fundraising, some very limited Medicaid payments, donations, and then we pick up the rest through operations. So that's about 12% deficit. In 2014, we served 128 Newmarket residents for 1,470 rides, meaning threshold to threshold, whatever their destination may have been. And I would point out that a lot of folks go to doctors in other communities, and that's fine. We drive a lot of folks over to Exeter, so mainly the hospital campus, but there's not a limitation in terms of what we do. So the average cost per ride is $22. The average town's contribution is $9. Newmarket's average contribution is actually $6 per ride. I would point out in the entire program, which serves our Raymond and Newmarket communities, Newmarket has by far the highest number of riders and the highest number of rides. So I think certainly we are connected. So that's just basically what Lamprey does. That's our transportation program, and I guess I would entertain questions if you have any. So, sir.
The percentages you quoted at the end, was that just for transportation, or was that your whole budget?
The percentage I quoted was just transportation. So as an overall budget, we're about 60% patient fees. The balance comes from grants, the federal grant, which is $2.8 million, some state contracts, which we took a big hit on the last few years with the budget cuts, and the community benefit grant from the hospital and some other things. So it tends to get smaller from there. So, thank you.
So as far as the rides, I mean, I know that was, you and I talked, that was one of the things that happened in January with the petition warrant. How many on average a day do you think in this town? I mean, if 1,700, I mean, we talking 3, 4 on general, or is it the same people? Is it spread out?
Well, it's roughly 50 folks, so it's every other week roughly. So folks are getting out to the bank, getting out to do their grocery shopping.
Right.
I like to think folks don't need to be at the doctor every other week, but as you get older, sometimes
yeah.
that happens. Or if you're dealing with a chronic condition like diabetes or hypertension, we might need to see you more often. But that's probably an accurate estimate of each day, 3 to 4. But we may focus on a different community each day too. So the bus may be headed out through Raymond and in that neck of the woods, or today's the Exeter route or something like that. So that it's hard to be efficient with that sort of program,
Right.
given somewhat limited ridership. I think the coast folks have proven that it's hard to make ends meet, so we've tried to cobble it together. And We've actually, in a recent grant opportunity, written for transportation health workers so that we could augment the program somewhat by having somebody more available to them. It's an opportunity to contact people, to be in conversation, to see what their needs are, and to make sure they're eating and making sure that they're seeing people and getting the services they need. So.
And that was part of why I asked the question, because I know the coast, I mean, they struggled, they couldn't make ends meet too, and
Right.
this is something where, it really is for the riders, and as far as the fees and stuff like that, there really aren't fees. I mean, it's,
Right.
you do what you can.
Right, and if you're able to make a small donation, that's
Great.
wonderful, but we're not gonna not pick you up because you can't, so that's
Okay.
important to us. So.
Go ahead.
I believe the petition warrant article was for $10,000?
Correct.
Two questions. One, if that didn't pass, would this service stop being provided for?
It would be it would change substantially. I think, with the deficit we're already running, if that didn't pass, we'd have to consider dialing back the availability. Largely the cost of the program are fuel and staff. So you got to lay off a staff, one bus off the road, so, the availability changes, and, maybe we don't do it as frequently, but it's,
Along the lines of that, I'm not sure what the town is going to do in the future for their budgets. They are asking to either keep budgets down or cut more. So
not an
I
unusual
behoove
situation.
you, or however you want to say it, to come during the budget cycle this next time around if we see it not on there. I think that was the majority of the reason of the controversy that happened, is we, as a budget committee, and the town people had zero information.
Okay,
We looked at the budget and we saw the budget come through without that included. We all voted on a budget without that included. And then the petition warrant article came in front of us and we had no one come and explain any of what you just did
okay,
to us. So we were unable to make, I don't want to say an informed decision. We waited for the deliberative session. We let people speak their minds. I, for one, voted for it. It was more lack of information than it was anything else.
Yeah.
well, I apologize for any confusion that may have occurred last year,
Well,
and
it could have
certainly
been everything transcribing, like you said before.
new guy, so my bad, and I'll step up and I'll make sure it doesn't happen again.
Well, it wasn't just that, because there was actually some, hard questions. Unfortunately, when it comes to a budget, it's always going to cause a controversy when things are either put in or taken out,
Right.
whoever you think it should be for. Some people asked, was the 10,000 just for Newmarket residents only? Was it a pooled money, and this goes towards Lamprey Healthcare, senior citizen transportation for people that are in Raymond, don't ever come to Newmarket? Those questions were answered, and we found out, but at the time, we just had none of that
Okay.
presented in front of us, so it was not a hard choice to make. It's a service that this town needs. It was just more of a lack of informed decision-making that we had to kind of be pressured to do, I guess.
Well, I'm happy to help where I can, and I'll see what I can do to
But like I
make sure
said,
that
I
gets in
have no
front of
idea
you.
what the town, we're not even close to seeing that. Unfortunately, like I said before, everyone is asking for lower taxes and tighter budgets, so.
Absolutely.
And that was part of why, when Greg reached out to me, I thought this would be a good forum, because the better educated we and the public can be, the more informed we can make on any decision, much less anything. So I thought this was just a great opportunity as we kind of start swinging into budget season, as we have some subjects that come up that we know might be coming up this year, just have a little bit more information now instead of after the fact.
Right. Well, I appreciate your time, certainly, so.
Any other questions, guys? Go ahead.
I just would like to make
Go
one
ahead.
more statement. If you are having a deficit, you can bring, and they decide to cut whatever, you can bring forth to make it balance it as zero. Not make money, not lose money. You can go to all the other towns and try and make it so it's a wash, because you are providing a service which this town, especially with the elderly population, it may even increase with
Sure.
longevity in life. And
Well, certainly we understand, the budget pressures folks face, and we're trying to make do with what we have, and from time to time it does run, as I said, a deficit, and we're reasonable in our thinking that you just can't keep coming back, and certainly trying to balance that amongst the towns that we do work in. So
Well-
I appreciate your,
the reason why I say that, $6 a ride, if it costs $10 a ride, I don't think it's that much out of the ordinary of saying, hey, we're hoping somebody get to and from a doctor for $10. I mean,
Sure.
come on. pretty easy service to provide.
Thank you very much. I'll keep that in mind, so.
Any other questions? I appreciate you taking the time
Thank
to come
you.
out. I really do.
Enjoyed it. Thank you. Nice to
And
meet you.
keep the dialogue, like I said. I mean, if there's anything else that we can help with, just keep the dialogue open.
My pleasure.
Cool. Thanks, Greg.
Thanks,
Evening,
Mr.
gentlemen.
Thank you.
Thank you.
Take care.
Which leads me to the budget process. So last Monday, we had our first ever meeting of the chairs. It's part of the charter, but we kind of pulled everybody together. So CIP was there, Conservation was there, Town Council was there, Planning Board was there, School Board wasn't. Nathan couldn't get there; he had a last minute thing. But kind of what I took out of it from the meeting is it's going to be an interesting year for us. And what I mean by that is the general consensus that I got from Phil and Steve is they want to deliver a flat budget. I mean, that's their goal, is no tax impact, things like that. But one of the things that definitely is becoming clear is while they've been holding off, waiting for something to happen with the school, they've been just holding steady. But now it's pretty obvious our roads are in pretty bad shape. They have to put more money into the roads. They're going to ask the CIP for more money for the roads. There's going to be some things that they're going to have to take care of in order to go forward. So as much as they want to deliver a flat budget, the reality is the town is going to have to start taking care of things that we've been putting on hold for years. And I mean, we've been looking at budgets now 3, 4, 5 years, and you can see that we just keep putting it off. So with the school, I think we all know that, kind of what's coming with that is, I mean, we obviously have a teacher's contract that needs to be negotiated for collective bargaining. They hope, I mean, Mike's downstairs actually right now interviewing architects. They hope to have something with the school, whether it's a remodel, whether it's a build. They're hoping to have something on the March ballot. That's their goal. They've been working nonstop all summer, literally. And knock on wood, at the rate they're going, I think they might actually be able to deliver something. I really do think they're doing their due diligence and really trying to make it happen. So we'll see. But with that said, we kind of all have a few things kind of coming to head all at once. So this is kind of the year where I could see where we're going to have some really tough budgeting sessions and questions and stuff like that. So with that said, I tried to look at the calendar for last year. And I've already reached out to Christine. I've already reached out to Steve and trying to set a little bit of what November and December could look like to where we could have our meetings. I mean, we obviously have one more in September and October, but this is kind of when the budgeting season will really jump up. So the budget is due to us by the 19th. By the 15th of November, the town needs to deliver the town budget to us. So the 23rd and the 30th will probably be the work sessions for those. We'll do like half the town one night and half the town the other, rather than go till midnight or 1 o'clock like they've done in the past. I thought it worked really well last year and the year before, where we broke it down into halves and halves. And then the school budget, it needs to be approved by the school board on the 19th, and then Christine will get the budget to us on the 24th. And she asked if she could meet us on the 7th, which is a Monday in December, to start that off. So I put down 2 work sessions because I put down the one pretty much strictly for the budget. The second one, by then, we'll probably have a better idea of what some of the warrant articles and things like that will come to fruition, because they're working backwards on the timeline on what has to be delivered. And in order to make that happen, they would have to have some things figured out by middle of December at the latest. So that would give us an idea to kind of look them over, have the town budget hearing for the town budget. And then I didn't do January yet because I'm still waiting on looking at some of the deliberatives and the timelines that have to be delivered on. But that's kind of November, December in a microcosm. How does that look to everyone?
I think it has to be done. CIP, just for everyone's information, is basically working backwards to be done with everything by the end of September. That's the goal there.
And then they basically take everything that's there and they propose it to the town council, and then the town council goes from there.
Correct. And schools, it's just completely unclear what's going to happen with the schools. They will certainly present something to us, but if we make a recommendation, do they care? If we don't make a recommendation, do they care? It's completely unclear. Nobody from the schools presented themselves at the meeting.
They haven't come yet. The only thing I understand is the school has to present if they want to use impact fees.
Correct.
And in order to use impact
for that
fees, they have
part,
to
I
do
think
that.
they will, but-
Okay, because I think they're looking to use impact fees coming up for one of the things that they need to do. I want to say like 60,000 if I remember right.
Yeah, correct. For that part, they will need to put that in there.
Okay. We know a little bit that the school, that the elevator, we're looking at October-ish. I'm being generous. I don't know what the cost, I mean, I know they have their contingency, but I don't know what that will turn out to be. I think when we talked last time, it was like 79,000 they had set in the contingency budget fund. In talking to Steve and talking to Christine, obviously the last time she was here, it looks like the town, very, very preliminary numbers, guys. I mean, he's going to present at the town council probably in September, but it looks like they came within the budget of about $120,000. So they came within like 1.2% of their budget. So that was actually really good. The school looked like it came in about 3.8, 3.9. It was like 622,000, but I don't know what the final was and what they put in funds. We won't have that till September, but that's kind of an idea. And I do know just in talking to Nathan and that they're trying to really try to cut that budget down as much as they can so we don't have these huge surpluses, especially with everything else that's going to be coming on the books. So that's just kind of the starting point where we are. Which leads me to my next thing. Are all of you available on September 8th? It'll literally be for like 15 minutes, and I'll tell you why in just a second, but I just want to, it's a Tuesday, because it's the Tuesday after Labor Day. I know schools are starting up, so I'm hoping that, we're around. But Steve, it's going to be a special meeting of the Budget Committee. We're going to have to approve. The town council is applying to the DRA for an emergency expenditure from the water fund because the McIntosh well is going to be a lot more than originally cost out in 2012. So in doing it, it's going to be about $800,000 more that they're going to need from the water fund. So they need to do a special resolution at the town council meeting on the 2nd. And then once the town council approves it, then it needs to come to us and we need to approve it. Steve sent me the memo and just kind of gave me a heads up. So I'll have more information at that meeting. I literally just have just a little bit now because until it passes the town council, I don't have any hard numbers. I just have a rough guess on what it's going to be. But I would say, 6:30, 7 o'clock, whatever's best for you guys. And it's literally, I think, 15 minutes. We just have to vote on it and give it to Steve and then move on.
That's the 8th.
Yeah, it's that Tuesday, the 8th.
Yep.
I mean, I'm flexible with time, whatever we need to do. Is that good?
6:30.
6:30?
For me, yeah.
Is that good?
Yeah.
Lou, is that all right? All right, so I guess we should make it official. Can I get a motion for meeting on September 8th at 6:30 p.m.?
So moved?
Okay, so Mike.
Second.
Will you be able to get us information
As soon as I have it, I will get it to you.
before that?
Yeah.
That would be nice.
I have a little bit, but I can't share it yet until it's all official.
I'm a water user.
Yeah, no, I am too blue, so that's why I have the question. Here's what I do know. We have a surplus in the account of 1.5 something, so we have the money to use. The only time it would be a concern is if we had to add a fourth well, and then what would that cost? So it shouldn't hit the taxpayers, or the ratepayers, I should say, rephrase that, the ratepayers on the water usage, because they have it in the fund, but it's just taken away from that emergency rainy day fund that if something happens.
But it's still $800,000
It's a lot
that
of
nobody
money.
was planning on spending, so
I,
regardless.
when he sent me the first email, I was like, okay, and then when I got the amount, I was like, oh, that's going to be a tough
Relative
one.
to the original cost, can you remind me what's the percentage increase on the original plant? Any idea?
Probably about 32, 33%.
Okay.
The original, the bonding authority was 2.5. And it's going to cost 3.3. So it's almost a third.
That was in 2012, correct?
2012 was, they did the bonds for it, and then they went out to bid for the project earlier this year, and they received 5 bids, and the lowest bidder came in at the price and they took it, but it's going to cost us considerably more than what they had budgeted in 2012. It is 3 years later. Inflation, unless you're the stock market today, sorry. I want to look at my 401k at this point.
What's that?
Yeah. So it was a substantial difference. So what they need to do is he met with the town council, and then they need to make the application to the commissioner of the DRA, and then they'll propose to withdraw the money from there. Oh, I take it back. There's 1.3 million in there, not 1.5. Sorry. So that would leave $520 some odd $1,000. It gives sweaty palms a little bit that that kind of money for how much work we're doing will be gone, but at this point it's what needs to be done. So
Is there a real short explanation for what went wrong? Like real short?
real short, from what it sounds like, it's more about the blending and what they need to do to blend the wells. Because we met when we talked at the meeting of the chairs, it was a little bit about the blending of the wells and the engineering and what needed to be done. It was just the cost they got in 2012 versus what they just quoted out in 2015.
Something they
was-
just weren't able to
Yeah.
plan for because they couldn't see what all the issues might be.
They couldn't see all the issues, and again, I think it's the byproduct of holding steady, not putting money aside for roads or anything like that, and then we got caught, and we're doing what we have to do, but it's one of those things where we've been playing it so close to the vest for so long that now we're going into bone. It's just, what do we do to make this happen? And that's where I say I think this budget season this year, we're going to have a lot of tough conversations, because in order to keep the tax rate in a reasonable level, there's going to be some hard questions and some hard things that are going to have to be looked at. Because that one, like, I didn't expect it that, to be honest with you. Like, when I saw it, I was like, wow. Because what if we didn't have that money? That's a huge impact to the taxpayers. So we'll meet for all those in favor of said meeting, say aye.
Aye.
Unanimous for everyone that's here. I will make sure I follow up with Gail, Larry, Craig, and Meg, and also get with Patricia to make sure that we're all here. And like I said, it's probably a quick 15 minutes, ask questions, sign off, and move on. If you do get a chance, the town council meeting on the 2nd, I would highly recommend watching it, because that'll probably educate and give us some of the answers we're looking for before we get together that night. So we'll have a little bit more education. So I know they talked about it last week, so it should be on the 19th meeting on the site, if you want to look at that too. And that'll give you a little bit of background, but hopefully we'll have a lot more answers next week, and I'll work to get those from Steve. He just sent me this right before our meeting, because I was trying to get it, so. Any questions on that I can answer?
On your calendar for December 30th? You have last day to post town budget public hearing?
I think it's the 31st.
New Year's
No,
Eve?
it's for,
Or is it the?
that's the last day that they have to do it, but we can have the hearing sooner than that, but they have to post it for a public hearing by the 30th of December.
But we already had the public hearing.
Right, but that's what I'm saying, the town has to
14th.
post it by then, but if we have it earlier, that's okay. So we'll post it, we have to post it 10 days beforehand.
Ah, gotcha.
That's just the deadline that
If
the
we have
town
to.
gave, that we have to have it posted
Okay.
by then. So if we have our meeting the 15th, or 14th, all that much better.
Okay, gotcha.
Okay. Any questions on that? Okay, next thing. So we did this last year a little bit. I just want to get it out as a quick reminder, especially for Dan, and Jeff. We had a Larry, Daryl, and Daryl, I mean, however you want to. We had a meeting with the lawyers for the town last year, and I really thought this one, some of the dates were important on here, and especially with the 10% rule, because the last time we had a bond article come for the school, we all of us on the budget committee were educated to the 10% rule that we weren't aware of before. But also there's some things in there as far as exemptions from the 10% rule. Collective bargaining agreements are exempt from the 10% rule, which we know we're going to be dealing with the teacher's contract. So there's just some dates in there that are from the RSAs and everything that I put down on there just for education. So we know as we're getting into the season kind of what our role is. I think Steve and I think all of us have a pretty clear understanding of what our role is, this year. I just see a lot of big questions coming up this year. So I just wanted to kind of get this out there, especially with the 10% rule, because if something doesn't pass, then that could change the dynamic of a lot of the warrant articles. Knock on wood, if everything's presented well and it's a good strategic plan, I think we'll be okay, but.
When you met with chairs, was Chief Sears' presentation about merit brought up again at all?
Not at all. And honestly,
Did chairs, well, if it wasn't brought up, then no, they didn't discuss it.
we didn't discuss it at all. I mean, I'll be honest with you, it was our first meeting, so it was a little bit of a squirrel meeting. We kept going down different paths and talking about different things. But what I asked from them is I think twice a year meeting was great. One right before budget season, so we can kind of know what the town's looking at, what the school's looking at, what the CIP's looking at, the planning board, the conservation commission. What are the things that they're going to need? But what I heard was trying to deliver a flat budget. To your point, they did talk about a salary survey, that they are doing a salary survey just to kind of see what it is out there and are we doing the right thing. So they're doing some research on all that. We didn't specifically talk about the merit increases, but they did talk about how they're doing the salary survey and they're looking into some of the things so they can have more information when they get to their budget session.
The reason why I asked is during following that presentation, the town council had another meeting and talked about how now that the charter says it has to be done yearly, it's probably going to be hitting this budget this year as well. So keeping a flat budget
It's going to be
plus
really,
merits is
really
going
tough.
to be difficult.
And I applaud the town council for doing it for years, but it's getting to the point where I'm concerned with the roads and stuff like that, they're going to be, I don't know if they've asked, but it looks like about another $150,000, $160,000 for roads they're going to ask to put in that fund. And then they're going to do a survey and they're going to start to figure out like what roads are the ones that are the top priority, which ones are, as Steve said, they've been doing Ash Swamp ever since they started because it's so long. That's been about the only road that's really gotten a lot of work, whereas Grant and some of these other ones are, in decline. Packers Falls, your street. I could go on. So they're really trying to look into that and how do they strategically go after it. I definitely felt really good in listening to Steve and Phil that, they really have a plan to try to tackle all this, but it's just going to get to a point where, exactly as you say, Blue, how can you do that on a flat budget?
There are some things that are just going to.
They're gonna go into need to get done. And that's why I think the more we can watch some of these meetings and really listen. I know, Dan, you're at almost every school board meeting, but keeping ourselves educated on the process and everything that's going on right now. You have an in to the town council, so you can keep us posted. It's just kind of educating ourselves, knowing what's coming up, because the better we have an understanding as we get into it, the easier it'll be on us, and we don't have to ask a million and jillion questions in December. And I think that's my goal over the next 3 months, is how can we just be more prepared for November and December so we have a lot of the answers before we get to the budget process.
Well, Dave, I think your point of, for instance, watching the town council meeting next week, so we can have, come in better educated, for that vote the following week. That's the best thing, or at least watch it, online, on demand later on in the week before.
When you're on an airplane flying somewhere back or something like
What
that.
have you, just kind of, that way we're not coming in cold on the 8th and asking 10 questions instead of 1 or 2 clarifying ones or something like
Right.
that.
So, that's kind of just what I see going on over the next, 3 months. I think September and October are going to be just easygoing, educating ourselves, but then Things are going to come to a head probably I think October 15th is when Steve has to deliver his budget to the town council. And then they go through it, and they go through department by department by department, and then that's when we get it in November. And then the school board, Christine's, like she already emailed me, 4 months in advance, so that's a great thing. So she's already planning it out, and she's really looking at it really tight this year too. I know, just watching the school board meetings and listening to her, she's really dialed in, trying to see where they can peel back and cut back, because they know there's going to be some expenditures coming.
Yeah.
So, any questions on the timeline? Are we all good with that? Any issues? I know November, December, we got like 5 Mondays in a row. But really, by doing that, it takes it a little bit easier on ourselves in the beginning of January. I thought it worked really well by having the town budget meeting in December last year, because really the school was the one where there were a lot of questions. And I think there will be again this year. Cool?
Cool.
Yep. So we're all set for Tuesday the 8th. I will make sure everybody else gets that. Anything else or any other business you guys would like to discuss tonight? Nothing? Do I have a motion to adjourn?
So moved.
Do I have a second? All those in favor?
Aye.
Welcome back from summer, guys. School's here. I know, isn't that scary?